Hello, Dr. Andrea Schnowske from Align Life of Peoria in the Metro Center. So, one of the concerns that we have a lot of times in our office is bloating. Now, if you know about bloating, you can have bloating in your upper stomach, where it's kind of right below your rib cage area. You can have bloating in your lower stomach around your belly button. And then sometimes we can even have bloating further down, like around our ovary area or that lower abdominal area. So, we're going to talk a little bit more about bloating today. So, as you know, November, we've been focusing more about digestion and some of the issues and health problems that arise from that. So, we're going to talk, like I said, about bloating today. So, bloating in your stomach or your lower abdomen can be very uncomfortable and sometimes even painful too, especially if you have a lot of buildup of bloating going on. Some of that bloating can be a result of excess gas, actually due to certain foods. So sometimes if your body's not used to, digesting things like beans or, heavy fiber intake, a lot of times as your body breaks that down, you may have some extra gas produced from that, especially if you don't eat those foods a lot or very often. The other thing that I would say probably happens more commonly is that the actual good bacteria or the gut flora, which is your bacteria, I like to say it's a little bit unique to you. So you have basically a blend of good bacteria that help break down your food. Those same bacteria actually help to make vitamins and minerals for you. And those same bacteria actually will protect the lining of the intestine by some of their waste products. So it's really important to understand that sometimes when those gut flora are imbalanced, where some of your, more protective vitamin mineral makers, they should be at high levels, but sometimes if we've had, either poor diet or if we've had issues with stomach problems or foods that we ate or sick or something like that, also food poisoning sometimes can cause those bacteria balance, or even medications can cause a bacteria balance to get off of normal. And what tends to happen is when we have those, I call them bad bacteria, but you can have other bacteria that are growing inside of your gut that tend to produce gas as part of how they break down food. So sometimes if we have more of those other bacteria present, they can actually produce gas as a byproduct of breaking down your food, and then you'll get more bloating and more gas from that. And another thing we can see is also immune system issues, where we actually have like an immune system reaction to the foods that we're eating, or sometimes even inflammation happens from the food that we're eating. So if your body's having some sensitivity issues, certain foods may cause you to be more inflamed, and actually can cause swelling and some of the inflammatory cytokines. So those are going to be more of your inflammation factors in your body. Those can actually come up as a result of foods that are being partially digested too. So if you have foods that, I'm not allergic to anything, but you notice that after you eat them, you get some bloating, that may be a sign that your body's having some issues with inflammation or sensitivity to certain foods. So in our office, we use a kind of a combination of things to figure out what is going on for why you have bloating. Typically, we look at number one, looking at, is it possible that we have some bacteria imbalance going on? So if you've been sick, if you've taken antibiotics, if you've had food poisoning, if you've been, drinking water that wasn't clarified properly, or possibly some spoiled foods, we may have some of that bacteria balance off. You can also have yeast overgrowth as well that can also cause some symptoms of bloating and things like that. So typically we start with using an herbal blend that actually interferes with production of those bad or other bacteria, so that we can kind of slow down the rate that they're growing so that we can lower their numbers a little bit. In some cases, we actually have to heal the gut lining if there's any irritation or inflammation that's damaged it. And then typically we need those good bacteria back in. So a lot of times we'll add in a probiotic. We do have to sometimes do a very heavy dose to make sure that we get their numbers up to where they need to be and make sure they're running the show down there, not the other bad guys. But typically we're going to help work with you about not only what you can do supplement wise, but also what types of foods and things are going to be best to help those good guys get back in there, flourish, and really take over the show. In some cases, when we have patients that are having a lot of issues with, inflammation, when they're eating, they're noticing issues and they've kind of stopped or slowed down or kind of stopped varying what they're eating, we may even need to do some food allergy testing to see what your body is becoming inflamed from and what's actually launching that bloating or inflammation response. So if you want more information about how we can help you with bloating, give our office a call. Again, I'm Dr. Andrea Schnowske from Align Life in the Metro Center. Our phone number is 309-689-6200. And again, we just want to help you get to the root cause, find out what's going on, and see if it's something we can help you with. So have a great rest of your day, and hopefully you learned something today.